Hello. You have been asked to come to a paediatric allergy clinic because either you or your GP are concerned that your child has an allergy. This video will tell you about the appointment and how to best prepare for it. Firstly, if you can't attend the appointment you have been given, please call us to make alternative arrangements. Your child must stop taking any antihistamine medicine before the appointment. The appointment letter will tell you what to do. On the day of your appointment, please bring any medications which your child takes, as well as any foods or substances which trigger the reaction. Arrive at the hospital in plenty of time so you can find a parking space and make your way to the clinic. The appointment may last for up to an hour. When you arrive, please tell the receptionist that you are here. You and your child will be called in to see the doctor. To begin, the doctor will want to find out about your child and what you have seen that makes you think they have an allergy. Here are some examples of the questions which they are likely to ask you. Does your child have asthma, eczema or hay fever, or is there any family history of these conditions? Was your child bottle or breastfed, and how old were they when they were weaned? What are the main foods in your child's diet? Are there some foods your child cannot eat for cultural and religious reasons? They will then want to know about the foods or substances that seem to cause an allergic reaction for your child. We call these allergens. What is it that seems to cause an allergic reaction? What was the age of your child when they first had their reaction, and who observed it? What is the exact nature of the allergic reaction, and is it the same every time? How quickly did the symptoms occur after your child comes into contact with the allergen? And how much of the allergen is required to trigger a response? What is the frequency of allergic reactions, and are these at home, school, or elsewhere? What treatments has your child received for their allergy, and have these worked? This includes medication, diet changes, and avoidance of certain substances. It helps if you've thought about these answers to some of these questions before the meeting, so you can provide as much information as possible. Your child will be examined, weighed and measured, looking specifically at their growth, any indications that your child is not eating enough, and for any signs of eczema, asthma and hay fever. The doctor will decide if any further investigations are required. A skin prick test is the most common test we do, and this can often be done on the same day. If your child needs a blood test, we may have to call you back on another day. Most of the time, your child will be given a diagnosis by the doctor on the same day. If you have any questions about the clinic, please ring the appointment office.